Hi, my name's Emily Handler. I'm one of the nurses in the cardiac rehab program. And today we're going to be talking about the coronary anatomy, the heart, and risk factors for coronary artery disease. By the end of this class, we'd like you to be able to identify your heart condition and have a better understanding of what that is, as well as treatment options for your heart problem. In addition to that, we'd like you to be able to identify your risk factors for coronary artery disease and even be thinking about what a plan might be for you going forward and taking control of your heart health. So let's begin. The heart is a muscle. Its job is to pump oxygen-rich blood throughout the body. It's about the size of your fist. So if you make a fist, that's about the size of your heart. I am using a model here today that's a lot larger than your heart, but just for viewing purposes. So I'm going to show you some of the elements of the heart. The heart has several functions. One is it has a pump that comes from the muscle of the heart. When it contracts, it expels blood from the heart. It has an electrical system that starts from the upper right chamber of the heart, and it has its own blood supply, which is the coronary arteries, and they supply the outside of the heart. The right coronary artery to the right and back of the heart, the left anterior descending, the front of the heart, and the left circumflex, the left side of the heart, and the back of the heart as well, depending on your own anatomy. Now, you may have heard of quadruple bypasses. These vessels, the coronary arteries, do split like the roots of a tree, a root system on the tree, so that you'll know some people's anatomy may have more than the three major arteries that they may bypass. So we'll talk more about that later. So I'm going to bring your attention now to this little model over here, because I think it's helpful to understand and to review those heart functions. The heart is actually like a house. I'm going to put a roof on it. And it's actually like a duplex. It has a right side and a left side. It has an upstairs and a downstairs. But it is separated by that wall in the middle. Okay? So I'd like to just show you, following a drop of blood, the circulation of the heart. The blood flow will come into the right side of the heart, the right atrium, that upper right chamber. That's used blood that doesn't have any oxygen. Then it gets pumped through a valve, will kind of look like stairs, that's the downstairs of the heart, to the ventricle. From the ventricle, there's another valve that will take the blood flow to the lungs. So to the lungs. From the lungs, it gets oxygenated back to the left atrium, through the mitral valve, or the stairs, downstairs to the ventricle. From the ventricle, through the aortic valve, through this big vessel here. See this big red vessel? That is the aorta. Okay? So this gives you a sense now of the blood flow throughout the body. The reason I want you to understand about the connection between the heart and lungs, you will see in a little bit as we talk about the different problems that can occur with the heart. Okay? This house, or duplex, it has its own electricity, as I mentioned. So sometimes people have trouble with the electrical components of the heart. That might be called arrhythmia. A normal heart pumps regularly and in a rhythmic way. Lub-dub, lub-dub, meaning the atrium contract and then the ventricles contract. That's a normal electrical system. Sometimes there's an arrhythmia in the upper chamber of the heart called atrial fibrillation, perhaps atrial flutter. This kind of arrhythmia is more bothersome than risky, in the sense that it is not lethal, it isn't life-threatening. However, it does make you more prone to clotting if the rhythm of the heart is not regular and if there's pooling of blood. So it's possible that clots can form in atrial fibrillation, and this is the reason why anticoagulation is very important to prevent stroke. And then you can also have rhythm disturbances in the bottom chamber of the heart. This could come from an anatomical problem with the conduction of the heart, or it could be a secondary problem related to a lack of blood flow to the heart muscle, or maybe an infection in the heart muscle, or a weakness of the pump itself, okay? So we want to be talking about all of these elements. So just to review, a normal heart has regular electrical component beating regularly and rhythmically. Now we want to talk a little bit about the pump of the heart. So the pump, the major function of the pump is to pump oxygen-rich blood throughout the body. So as you see, the wall of this left side of the heart is stronger and has a more forceful pump. This is the blood that's arterial blood. As you may have seen, it pulses and it spurts. Blood can be very, very forceful if you hit an artery. You've probably seen that maybe in the movies. But in reality, there is a pulsation, and there's quite a bit of pressure, and that comes from the strength of this wall here, the ventricle. So what I want you to understand is if that wall is weak and the pump is not functioning properly, there'll be backup of the blood flow. And if we can go back to this diagram and remember where this blood, the blood that went into the ventricle, came from, we can see that the pressure builds back from that pump not pumping properly. It can build up into the lung, causing fluid to disperse into the lung and causing shortness of breath. And there we come with the contact of the heart and the lungs that is important. So we want to be understanding that if you have a weakness of the heart muscle, which may be from infection or from many heart attacks, sometimes called cardiomyopathy or congestive heart failure, there are a number of steps that you can take to manage your health, and your physicians will review those with you, as will your nurses in the cardiac rehab program. Daily weights, watching and reporting any extreme change in your weight, shortness of breath that might wake you in the night, swelling in your ankles. These would all be important things to report in your cardiac rehab sessions. So we also want to talk about the coronary arteries that supply the heart with blood, because that's what we're talking about primarily in cardiac rehab, is preventing the progression of coronary artery disease or atherosclerosis. So atherosclerosis is an umbrella that would cover peripheral vascular disease, so if you have pain in your legs when you walk, or carotid artery disease if you have had a stroke, perhaps from lack of blood flow to the heart, to the head, to the brain, or if you have coronary artery disease, which we're going to focus on most today. So with coronary artery disease, the problems come with blocking of blood flow. So as you spoke about in symptom management and recognition, you'll learn about the difference between heart attack and angina. But we want to talk about what is happening at the vessel wall. And what we know is that risk factors, which are bodily traits and habits that you have, and lifestyles that you have, that will contribute to the development of coronary artery disease. What happens on the vessel wall when you have risk factors is that the lining of the wall can get damaged, allowing for lipids and healing cells to go into the wall and create some difficulty. Or here's a normal vessel, and if the wall is broken, between the lines of, or the layers of the wall of the artery, there can be some buildup of plaque over time. And this impedes blood flow. So that can be called ischemia, or lack of blood flow to the heart muscle. It can be temporary as an angina, or it can be prolonged as in a heart attack, where damage to the heart muscle occurs. So we're going to be talking now about risk factors and how we can intervene on this, and what your role might be in helping your health and helping in your recovery. Back to risk factors. The four major risk factors for heart disease, as you probably are aware: smoking, and smoking can damage the arterial wall. It also takes the place of oxygen, good oxygen that supplies the cells with oxygen that they need and nutrients that they need. So what can you do about smoking? Well, of course, we'd like you to quit, and it's easier said than done. We want you to be aware that there are many, many tools to help you with that process. Medications are one option. Certainly, there's so many options. We want you to discuss that with us and to come up with a plan of what seems reasonable for you personally. And so that will be done on an individual basis. But if smoking is an issue for you, please just be forthcoming. We can't help you unless you share your story with us and your challenges with us. And then secondly, high blood pressure, also called hypertension, but not to be confused with stress. Hypertension is actually a high blood pressure. That is related to the pressure that comes on the vessel wall. So the first number of your blood pressure is the pressure on the wall when these ventricles contract. That's the systolic blood pressure. The second number of your blood pressure is when the heart's relaxing between beats. So most important that you have both a strong contraction but also an ability to relax the heart muscle. And so hypertension becomes a risk for coronary disease because it can also damage the walls of the arteries, and it also tends to make the vessels less responsive so that you don't have a lot of room to move when you need to increase your blood pressure or decrease it for whatever reason. Interestingly enough, exercise and regular exercise is very helpful for blood pressure management. Primarily longer durations, not quite as intense. So more exercise but not so intense helps with hypertension. In addition to that, lowering the sodium intake, which Deb will be talking to you about a lot, but think about canned foods, avoiding canned foods. Think about processed foods, smoked foods, and cured foods. Those are all tend to be high in sodium. So things to just be mindful of and avoid great quantities of those foods. And you may be told by your physician to actually be on a sodium restriction, but that would be something that would be individual to you. So hypertension is another risk factor. Another risk factor is what we call hyperlipidemia. So hyperlipidemia refers to low HDL, high LDL, or high triglycerides. So those are three lipoproteins that will impact the development of coronary artery disease or atherosclerosis. So HDL, we want to think about being high, happy, think happy. So we want that to be high. LDL, we want that to be low. And depending on whether this is primary prevention for you, or if you've had an event, or if you have already established coronary artery disease, those numbers and goals will change. So I'm not going to review those exact numbers right now, what your goal is, but thinking about where those stand is helpful to know. HDL you want to be high. And how do we get HDL high? Well, sometimes we inherit it. But exercise can help you boost HDL, so that's a good thing to remember. Also, good fats can help raise the HDL. The LDL, well, what makes that high? We want that to come down. So that is about the fats in your diet, particularly the saturated fats. And I'm not going to go into a lot of detail, but Deb will give you lots of information about saturated fats and how to manage your LDL with diet. Also recognize that both for hypertension and hyperlipidemia, and even smoking for that matter, medications are sometimes an integral part of your home management. So we will have a whole class on medications, and being very accurate with taking your medications regularly will also support your recovery. So another major risk factor for heart disease is being sedentary, not getting enough exercise, or being unfit. Perhaps even just being too sedentary, just sitting on the couch too much. So what can you do about that to decrease your sedentary behavior and increase your exercise? We'll help you get some guidelines to start from where you are. But Good ideas might be just to get up and move throughout the course of the day. Don't sit for 2 hours at a time or any longer than that without getting up and moving your body in some way. Stretch. Do a meditation, a walking meditation perhaps. Maybe brush your teeth or use the bathroom, get a glass of water throughout the course of your day. Exercise you need to actually schedule. You need to plan on exercise. That is something that you need to build up. So ultimately we want you, as you'll learn in the exercise class, to be getting at least 30 minutes of continuous exercise every day. So that's the bare minimal for maintaining your weight perhaps and not gaining weight. So it's important that you get regular exercise, and we're going to help you individualize that to what your needs are. It's something to think about. So those are the 4 major risk factors for coronary disease. There are also some other risk factors that are important to be aware of. People who are diabetic have trouble with sugar, as you may be aware, and they tend to be more predisposed to developing coronary artery disease simply from the fact that they have smaller vessels and they have another disease process on top. So it's important to manage your diabetes well if you have it. There's also something called prediabetes. You may not need medication yet, but your blood sugars are creeping up. Oftentimes this is related to weight gain. As we age, we gain weight, and that makes us more susceptible and the body less capable of metabolizing the sugars that we eat. So it's important you'll learn more about that in the program, I would say. But diabetes is another risk factor. In addition, being overweight or obese, either overweight or obese, think about it. If you're overweight, it's like carrying 2 suitcases in your hand with that extra weight all day long. So it's a lot of work for the heart to move all of that around. So we're going to work with you to try to set a weight goal and help you achieve a 1/2 pound to a 2 pound a week weight loss while you're in the program. So we need your help. We need your help to be tracking. You'll be learning about tracking yourself, just noticing, observing what your behaviors are and why you might be the weight that you are, or why you might be making the choices that you are with your eating habits. And then lastly, I'm going to mention stress. So stress is an independent risk factor for heart disease as well. And stress comes in many forms. Sometimes it is a mood disorder where people can feel depressed, or they can feel anxious, or they might be sleeping too much or not enough sleeping. They might be drinking alcohol to excess. And you might definitely in these times now have some social isolation and feel not connected with others. These are all ways that stress can manifest itself and create trouble for the body. And we have a whole class about stress that we're going to be learning about. So I hope that we've covered those materials that we discussed today. The normal heart function, regular rhythm, strong heart that beats and relaxes normally, and excellent blood flow to the heart muscle through the coronary arteries. And I hope that you have better insight into your risk factors now and start thinking about what the plan is for you. What do you want to do? What risk factor do you want to start with?